You are watching TV9 Digital with me Amrita, and I will be talking about COVID vaccine updates right here in India, especially with Serum Institute of India now applying for emergency use authorization of its COVID vaccine candidate. As we all know, Serum Institute of India is currently developing the COVISHIELD vaccine, which is the Oxford University AstraZeneca's vaccine right here in India. It is also conducting the final stage trials here and also manufacturing the same, everything here in India. Now, what is it that you need to know about emergency use authorization of vaccines? How does it work? Is it safe? And most importantly, what are the pros and cons of a vaccine which is approved for emergency use? All of this I will be talking about in this episode. Now, first and foremost, let us get to what exactly is emergency use authorization. Now, any vaccine, drug or medical equipment like that of a PPE kit as well needs to be approved by a government authority. In India, this responsibility lies on the Central Drugs Standard Control Organization, or CDSCO, which gives these approvals. Now, when it comes to emergency use authorization, this particular term has been only been relevant in the past few years when we saw the Zika epidemic, when we saw the Ebola virus epidemic as well. So emergency use authorization in India is not as clearly defined as it is in other countries. In India, in fact, we even do not have a procedure to how to approve a particular drug or a vaccine or any other medical equipment for that matter under this category. However, the US FDA defines EUA as something that may allow unapproved medical products or unapproved uses of approved medical products to be used in an emergency to diagnose, treat or prevent a serious or life-threatening disease. So this is how the US FDA defines it. But right here in India, we have also given in the past few months amidst this pandemic emergency approval or restricted approval of use of certain drugs for the treatment of COVID-19, such as remdesivir and favipiravir. Now, about these drugs which have been given restricted use, the experts have criticized the government for giving this access because they have argued that the clinical trial data or any sort of information or result on how these drugs are being used, on how many people it is being used, what is the observations from using these drugs is not clearly available in the public forum for scrutiny by these experts. So this is something that needs to be taken into consideration. Other than that, as we all know, Serum Institute's application for EUA has also come on the heels of that of Pfizer in India also applying for emergency use authorization of its own COVID-19 vaccine candidate. In the UK, Pfizer has already gotten its vaccine approved under this particular category too. The US and the European Union are still verifying the data for Pfizer to take a stance on emergency use approval. So how will India grant EUA if it does at all? So in India, the Subject Expert Committee on Vaccines will review the early results of the vaccine candidates of both Serum Institute of India and Pfizer as well, and then take a decision. So far, Serum Institute of India has submitted the interim data of clinical trials conducted in India, UK and Brazil. Now, if we are to discuss the pros and cons of EUA, the pros will include that India will have a vaccine against COVID-19. We won't fall behind in the race. And at this point of launch, the target population is quite small. The government is targeting only the healthcare professionals, other frontline warriors, before giving it to the high-risk population. The cons are that India lacks a procedure, first and foremost. The second one is Serum's phase 3 trials are an observer blind study, which means that a certain group of people may receive a placebo instead of a vaccine shot. Now, if Serum Institute of India's COVID-19 vaccine candidate does get EUA permission, then it will be available for the larger public, and it wouldn't be fair for those certain volunteers to be receiving a placebo instead of a vaccine shot. This would, in other terms, mean unblinding the study, which again will compromise on the results which needs to be taken at the end of a study. Now, to talk about Serum Institute versus Pfizer in India, and also about other vaccines which are in India, between Serum Institute and Pfizer, the former is testing its candidate indigenously as well as manufacturing it here, while Pfizer is all foreign made. The second important thing is storage. Now, Pfizer's COVID-19 vaccine will require a certain kind of storage which is not easily available in India, while COVISHIELD, the Serum Institute's vaccine, can be stored under what we have already, the facilities that we already have. Now, in terms of cost, Serum Institute's COVISHIELD is relatively cheaper than that of Pfizer. However, no official figures have been made public yet. The only glitch on the Serum Institute side is the case of Chennai volunteer who claimed that he suffered neurological as well as psychological damage after participating in the clinical trials. However, this claim was also not accepted by Serum Institute of India, and the Health Ministry has not been keen on looking into this particular instance. The other vaccines which are currently in the race in India are Bharat Biotech's Zydus Cadila as well as Russia's Sputnik vaccine, which are all in their own clinical trial stages. And in the historical context, so far EUA for a vaccine has only been granted to a mumps vaccine, MMR vaccine, which took almost 4.5 years to be granted after it was developed. So keeping all of these things in mind, that we have provided the pros and cons to you, what do you think? That do the pros outweigh the cons, or is it the other way around? Do let us know in the comment section down below. Also like, share and subscribe to TV9 Digital.